preparedness in your email. I apologize for that because that makes it sound like I'm getting you ready for a flood or a earthquake or something, but no, I'm not getting ready for that, just for cardiac thing. And we're lucky today because we get to practice a little bit at the end afterward using an AED. So it's kind of important to know that because those are everywhere now. So we can do a little practice with that. So I think
this man has 2 right hands.
well, that's an emergency. That's an emergency right there. Okay, so and this lecture was originally made by Carrie and a EMT, I think, and I just changed it up a little bit. So I put Carrie's name on there too. All right, here we go. Okay, we're going to start talking about chest pain related to a heart attack. And so when you think of having a heart attack and you're thinking about pain, what kind of pain could you be having that would let you know that you're having a heart attack?
Pressure.
Pressure. Like the whole thing was typical with an elephant standing on your chest. Yeah. Jaw. Yep. And it's another one. Arm, specifically your left arm. Yeah.
Having trouble breathing.
Just being short of breath. Yes, absolutely. Yeah, it doesn't sometimes we think, oh, we're just short of breath because there's something in the air or is my asthma acting up or allergies. Yeah, so just shortness of breath can be. Yes.
I recall someone becoming very
pale. And then the next step is blue, but yes, pale first. Yes. Good job, you guys. Anything else you can think of?
Is the pressure heavy pressure or just the pressure?
It can be all different. That's the whole thing is everybody, that's the problem. That is the problem with recognizing if you're having a heart attack is that your pain and everybody's pain is specific to them and everybody's different.
I've always heard that it was different for women and men. Is that true?
We're going to talk about that. Yeah.
Okay.
A little bit. It can be.
Okay.
Yes.
What I experienced was, I thought I was having acid reflux.
Yes.
Yes.
Because it felt like what? What did it feel like?
It was burning.
Burning and kind of up here though, right? Yeah. Yeah, that's a common one. And a common reason that we don't call 911 sometimes is because we hope that it's just acid reflux, right? Yeah, Tums. Okay, so which chest pain is worse? There's not one specific chest pain that's worse than the other. It doesn't mean if you're just having a little bit of pain in your jaw or you're just having a little bit of pain in your left shoulder, that, oh, well, I'm not getting that elephant pressure feeling, so I'm just going to wait. No, you don't wait for the worst pain because just that pain in your jaw can be your worst pain. That can be indicative of that you're having a heart attack.
Yeah, sure.
You can have pain just right over your heart. Yeah. But there's nerves all over there. That's why you get pain sometimes in your back, through to your back, right? Why is that we get pain everywhere and not just right in our heart? Because there's nerves all over. And yeah.
Can you show us exactly where the heart is?
It's kind of right here. It's right, when we do CPR, it's under the sternum, but it's a little bit over to the left, but kind of right there. And everybody's a little bit different about that too, but in general, kind of right there. And it's about the size of your fists too.
You're both.
What?
You're both.
Yes, it's your really, that's right. Okay, so one chest pain is not worse than the other. You don't wait until you get the quote worst chest pain. Wait for that typical, elephant on your chest thing, because every chest pain is the worst pain. They all can be bad. Yep.
Usually sometimes you can look at a person and just the look on their face.
Yes.
They're in trouble.
Yes.
They're trying to figure it out.
They're hoping they're not in trouble.
Right, right.
Right.
That's it. It's confusion.
It's confusion and yeah. So they can all be bad. This is not my slide. This has got to be Carrie's slide. Denial, not just a river in Africa, but I left it up there just so we could have some of Carrie's humor here today. So denial is a big part. It's denial because we hope that it's not happening. We hope that it's just acid reflux. We hope that it's just our allergies, you know? So that's a big one, to just be a little bit in denial because we have being hopeful. But the important thing with having a heart attack is that time, how quickly you get treatment is equal to how much a muscle of your heart is preserved. Time equals muscle. If you don't take anything else from this lecture, take that. The time that you get to the hospital equals how much muscle you could have left in your heart. So if you delay and you get there 5 or 6 hours later, and there's a blockage going to your heart, that means maybe, you know, half of your heart muscle is dead now, because it's once that heart muscle doesn't get blood for a certain period of time, and we're going to talk about that, then it can die. And then once it dies, that heart muscle can't contract. So for then on, the other part of your heart is contracting. It's just getting dragged along, but it's not able to really contribute. So that contributes to your decreased cardiac output and how much blood gets to your brain and the rest of your body and all that. So time equals muscle. So seek treatment at the onset of symptoms for best outcomes in terms of preserving your heart function. Average delay time is, depending on the study, 1.5 to 6 hours, with about 50% of people waiting 4 hours after they start having chest pain or heart pain. What a heart attack feels like for men or women, there can be a difference. It's not always. You know, some women are going to have the elephant on their chest feeling, but women are more likely to just have symptoms such as feeling lightheaded or dizzy. Feeling fatigued is a big one for women, and that's so confusing because we're all fatigued, right? And you wake up, and some days you go to do the stairs to come here and you whip up them, and some days you get up the first set and you're like, oh my gosh. Or so it can be confusing, that fatigue. And that's why women are less likely to go to the hospital, is because I think it's more confusing. They may be sweaty, and that's the only symptom they're having upper body pain in their arms, in their back and their shoulders, neck and jaw pain. And of course, they can also have chest pressure, sternal pressure. And men, all the typical symptoms: sweating, diaphoretic, poor skin color that you talked about, Judy, shortness of breath, pain can radiate to the jaw. It's all this pain all over the place radiating because the nerves that are surrounding the heart, nerves just don't go here and stop. They all connect. So our nerves are connected, so connected all over the place. So you can get pain in, you know, going to your jaw, your shoulder, your back. Feeling sick or vomiting. We didn't talk about that one. Nausea, throwing up. That's a common one. And then feeling palpitations, just a pounding, it can be an irregular, just feeling pounding in your chest. Usually have more than one symptom, but not always. So the important thing is knowing yourself, you know, being aware of yourself. And if you're having something that feels different than what you're usually having, it's best to get it checked out. Time is muscle. Heart muscle death is related to the length of the ischemic episode. What does that mean? Ischemic means lack of blood flow. Yeah, ischemic means lack of blood flow. So if I took this rubber band and I wrapped it 2 or 3 times, if I could, around a finger and left it there for all day long, probably my finger would have been ischemic because it's not getting blood flow. It certainly will turn blue within 15 minutes. And if I don't take this off, you could get death. I could get death on my finger because there's lack of blood flow going there. Same thing happens in the heart. If one of those coronary arteries that are supplying the heart gets blocked off, you can see what's happening up there. This coronary artery coming down here, which is called the left anterior descending, has a blockage right there. If you don't get that opened up by seeking medical treatment and having a procedure done or using nitroglycerin, which sometimes can open it a little bit to get past that blockage. See what's happening to the heart muscle? The heart muscle is turning dark there. No blood flow. It can die. It can, that heart muscle can actually become scar tissue. So restoring flow to the affected artery within 30 minutes can stop an infarction. So it can mean that you don't actually have a heart attack. You've opened it up in time. If reperfusion, which means getting blood flow to the heart again past that blockage, occurs within 2 to 3 hours, some preservation of your heart function is achieved. After 6 hours, there is little or no chance of salvaging that part of your heart muscle that's not getting blood flow.
Is that a nice way of saying you die?
No, not necessarily die. If the blockage occurs in there's a left main artery and that goes at the top of the heart and everything comes off that. So your left anterior descending, your circumflex, your right coronary artery and all the little branches, they all come up that left main. So if the left main gets a complete blockage, then that means the whole heart is not getting circulation. That's called a widowmaker. But typically it doesn't occur there because that's a pretty big vessel there, but it can. But if it occurs, say, in the LAD, you can see right here, this is the LAD, it's occurring kind of at the bottom there in a little branch. So it's just a little part of the heart. So just that little part of the heart, the rest of the heart muscle can function and pump really well. Is anybody on here at home?
Yeah.
Okay, so the question was, does that mean that the whole heart's gonna die or that you're gonna die? It's just the part of the heart that's not being perfused because of that one coronary artery being blocked. Sometimes when they go in there, they'll see that you got a blockage on a couple places in the left anterior descending, or one in the LAD and one in the other one, and they'll fix both of those.
Yeah, your veins are all getting worse at the same time.
Yes.
So.
Typically, if you have a blockage one place, you've got at least a little bit another place. And these vessels are pretty small that go to your coronary arteries. So if you get some plaque in there and it builds up over time, and then a little platelet, there's always platelets in your blood. Say you've got like a 60% blockage, enough blood's getting by, you're able to do things. You might feel a little bit more fatigued, but then a big platelet sticks on there, totally occludes it. That's when you suddenly have, your jaw pain, your chest pain, and they have to go in there and open it up with a balloon or put a stent in.
Tom, did you have a question?
Well, I'm just gonna make a comment. When I had my heart attack, I didn't go in, and it was 24 hours later, about 12 hours later, the pain stopped because that portion of the heart was dead.
Yeah,
So
yeah,
nothing,
right.
you know,
And what was your pain that you were having?
like I thought, it was acid reflux.
Mm. Yeah. So I know we'll talk about why we don't call, but it's very common to have that happen. We all do that. So that's why I'm giving this lecture today. Yes.
Good, blood pressure, you don't take the blood pressure, that's good. And you still have a heart attack?
Yes.
You can't.
And sometimes your pressure will even be low when you're having a heart attack, depending on what's going on. So yeah, you can't take your blood pressure and say, oh, my blood pressure is okay. That means I'm not having a heart attack.
Good question.
Yes,
I
thank
had
you.
Widowmaker for about an hour. And by the time they got there, they took pictures before and after. You could see no blood, and that whole came towards
The whole heart, yeah,
whole heart. Then it all came back after the stent.
right.
That was over an hour. That I had that.
Before you went to the hospital or after you got there?
It was about almost an hour before I got to the
Ugh.
hospital. Then, of course, they took me right in. And
Right.
It took about 15 or 20 minutes.
You're
That-
so lucky. Yeah, so they were saying that they had a widowmaker, which means they had a blockage right at the very top. And they didn't go into the hospital it took a while to get to the hospital. We'll talk about that. And then once he got in there, it took an hour. But they took pictures before and after when he had a heart cath. And it showed originally that the entire heart was not getting blood flow because that primary vessel, that main vessel was blocked. And then once they put this stent in, it all opened up again, right? And did you have any damage to your heart?
I got one chamber that is doing most of the work.
Okay, yeah. Okay, so how quickly, we'll just kind of go over this again, how quickly you receive care and treatment for a heart attack makes a difference. And this was a study that was done by the American Heart Association in 2006. Survival rates are improved by up to 50% if you receive treatment within 1 hour of onset of symptoms. 50%, huge. 23% if treatment is achieved within 3 hours. So boy, it really drops if you wait 3 hours. But still, good to get in there in 3 hours. So it's very common for people to call their doctor if they're having these symptoms. Calling a physician's office increases delay in seeking treatment. They've done study on this. You call the doctor's office, right? You don't get through to the doctor. You talk to some sort of medical assistant. She writes it down. The doctor's seeing patients all day. You're waiting, and now you think you've done something because you've called the doctor, right? You think, oh, I've done something. You haven't done anything. I mean, that little blockage is just sitting there. There's no blood flow going and you're not getting treatment. So most individuals believe calling the doctor not 911 is the correct course of action. How many of you guys think that? It's probably best to call the doctor first. Not now. Those who call the physician, now that you've done something, you're less likely to, even 2 hours later, if the symptoms get worse, you're less likely to call 911 because you think you've done something. That the doctor's gotten this message. They didn't think anything about it. Believe me, they have not gotten the message. And even if they did, who knows what message they got, right? So patients who use 911 receive treatment faster than those who do not, for sure. And then once again, providers may believe that it's unnecessary to tell patients to call 911 because they assume patients already know to do this. How many of your physicians have told you if you get, chest pain that you think is cardiac pain, don't call me, call 911? Have any of your physicians told you that? Over there, yes, one. So they've got other things on their mind. They don't think to tell you that, to not call them, to call 911. And I remember when I worked in cardiac rehab over at UC Davis, all the time we had patients that would call us from home and say, oh, I'm having chest pain. What are we going to do? So except to say call 911. And if you're not able to call 911 yourself, we'll do it for you. So many physicians are unaware of the strong evidence showing the detrimental consequences of patient delay in treatment. So that's the other reason. They're just not, it's not in their cardiologists. I think it's front and center in their mind, but your primary care physician, many times, not so much.
Tom has a.
Tom, yes.
I think the thing about calling 911 is you get first responders coming out, they can take some readings and stuff, and so you can go. I know when I called the doctor's office, and it was like, well, you can go to the emergency room. Well, as soon as I say that, I'm not going to go to the emergency room.
Yeah.
But
Plus, you don't want, we'll talk about this, but you don't want to drive yourself to the emergency room. Having worked in cardiology for years, I have so many stories of people that tried to drive themselves to the hospital and then became unconscious because the blockage was gotten worse and there was no blood flow and their heart went into fibrillation, right? So, and they had an accident and you don't get treatment. Driving now, I mean, it could take you an hour to get to the ER. So you don't want to drive yourself. You don't want to have somebody else drive you either, because what are they going to do if you pass out? Good point, Tom. Thank you.
At least in the ambulance, they're giving you all.
Yes, they can get an IV started. They can give you nitroglycerin, all that stuff.
Kudos to you, when I had my problem here, you talked to me easily into calling 911.
Right.
And, I didn't need a siren or anything.
Yes.
to the hospital,
Yeah.
But I looked at very shortly after.
Very quickly. Yeah. Yeah. If your blood pressure would have gotten higher, they could give you medicine like right in the ambulance to at least start treatment. You can at least start treatment. And definitely they'll use an AED, they'll do CPR if needed, all of that can happen. Okay, so why people, yes.
Is it true that if you don't, emergency room, ambulance, they're treated?
It's true. He's saying, is it true that if you come to the emergency room in an ambulance, are you more likely to get treated quickly? Yes, it's true. Yeah.
So the mistake I
Because they don't bring you in and dump you in the waiting room. They bring you right.
I mean, I had my wife drive me because we're only 2 miles from the emergency,
Yeah,
but it took a long time to see.
right.
And if I had gone in from the ambulance,
Yes.
they'd seen me right away.
Yes.
So it was quite a delay.
Yes, and they're gonna do, he's saying there's a delay, you know, in just trying to go to the ER and waiting to be seen and get triaged and all that, whereas if an ambulance, they'll bring you right in.
But also call the description of the symptoms.
Yes,
When I had a stroke, I called. She said, I'm bringing him in to the ER. He's this. And he said, okay, so.
so giving specific symptoms really helps.
So then they-
Yes. Yes. Yeah, that's important when you call to 911, giving specific symptoms can kind of help get things going.
You know, the other.
Mhm.
That,
No, go. All this stuff is so helpful.
the other thing is I got a pendant that says nitroglycerin on it.
Oh,
I was talking to a brother-in-law's physician and was telling him about this pill bottle. And they'll see all the ambulance people, they don't know what's in there. They don't even know it's a pill bottle. So by making it real obvious, by putting a medical symbol of nitroglycerin on it,
yeah,
they know.
they'll notice that.
Also. Put some information on here too.
Yes.
Like my normal blood pressure. you know, Information like that. but
Yeah.
that-
In case you're not able to give that
Yeah,
information.
Yeah,
Yes.
yeah, it's a little too. So I have my nitroglycerin. It's in injection every night and I'll make sure that it's dry. Not a clump of pills. Yeah. So, yeah, they just.
That's a great idea. Thanks for sharing
Got
this.
several of them.
One of the participants has a nitroglycerin capsule that looks really cool, actually. It's a
I got it from
silver.
Medical Alert.
Yeah, and he got it through Medical Alert that has nitroglycerin, and it also alerts if he were unconscious or unable to talk, it alerts the emergency providers that he has a heart problem. Okay, so why people don't call 911, all of us, you know, we're all the same. Sometimes, and you guys have brought up a lot of these, we misinterpret the symptoms. We believe it could be heartburn, gas, a pulled muscle, rather than a potential heart attack or other serious issue. We want to believe, we're hopeful always that these symptoms are just going to pass, you know. Give yourself a few minutes to see if it's going to pass, but don't give yourself an hour to see if it's going to pass. We have a big fear of overreacting, don't we? We don't want to cause a commotion for no reason. We don't want to be bothering those emergency people for, you know, nothing. You know, they don't mind being bothered and they don't mind if they come and they feel like it's heartburn.
The middle of the night, you wanna wait till.
Oh, they are up all night long. Do not worry about, my son is a firefighter. Don't worry, he's up all night long. Don't worry about calling. And plus they want to go out and do things, you know, they don't mind being called for important things. They don't like to be called for, can you give me a COVID shot?
They will recommend whether you go into the hospital.
That's right. They will recommend, they will say, yes, yes.
Another thing I think about is if it is in the middle of the night, getting to the door and making sure that they're able to come in.
Yes, unlocking the door.
Right,
Mhm.
so you have to maneuver yourself that far.
If you can,
can.
yeah.
You can't, right.
Yeah, just, you can tell them that, you know, they need to break a window or something if you can't do that. Yeah. They'll get in.
Thinking about not wanting to cause emotion. It's kind of tied into embarrassment. If something is going wrong, not wanting to attract attention.
Yeah,
People in the parks, we had a couple of cases at least, where instead of saying, hey, I'm feeling to shoot,
they'll go isolate themselves, right? Go to the bathroom. We're talking about how many times all of us, if we have a problem, we don't want to make a scene in public. And so we isolate ourselves. We'll go to the bathroom. It's very common. They've done studies on this, and women do it more than men. If women or men both, but more in women, if you're choking in a restaurant or at a party, you don't tell anybody, you don't stay there, you go into the bathroom. Nobody knows you're in there, and then people die in the bathroom because nobody knows, and they can't get a Heimlich maneuver, they can't get help. Same thing can happen with, a heart attack. You're not feeling well, you go in the bathroom, right?
It's the last.
Time of seeing somebody choking in the restaurant. And one of the other people, not medically involved, but big man, went over and did Heimlich.
Yeah.
On her several times. He survived. because
Yeah.
Another person did.
That's right. Another person noticing that you're sweating and your skin color doesn't look good. And even if you're saying, oh, I'm fine, that other person stepping in and calling 911, right? So, disbelief or denial, individuals might doubt their own symptoms or try to downplay how sick they feel, just because we don't want this to be happening, right? We don't want this to be cardiac. And we think if we call 911, all of a sudden it's going to become cardiac. It is what it is. It's better to get it checked out. Perceived speed of transport. Many people believe they can get to the hospital faster by driving or having somebody drive them than calling 911. That is not true. That ambulance is going to get there quickly. They're going to get you to the hospital quickly. But more importantly, they're going to start treatment immediately at your house. They're going to get an IV going. They're going to give you nitroglycerin. They're going to do an EKG. All that stuff is going to be done. There's no delay in treatment versus having somebody drive you, stopping at lights, going through construction, all of that. And then people are concerned about the cost of an ambulance, the financial cost. So we're going to talk about that too. So make the call 911. When to call 911. Of course, this is like a general one, and besides cardiac, why do you want to call 911? If you're having shortness of breath that feels severe to you, or you feel like you can't breathe, can't read this slide here. If you're having an allergic reaction to something, you're getting your throat's closing up, or you're getting a rash all over your body, call 911. Having symptoms of heart attack, which is what we talked about, and also stroke. Feeling disoriented and confused, or if you noticed, somebody in your house is disoriented and confused. Having difficulty speaking or seeing clearly, drooping of the face, all those can be symptoms of a stroke. And having sudden severe pain you don't know why you're having it, and it doesn't go away within, 5 minutes or so. And it's so severe, it's like a 9 or a 10. So don't call 911 if you want to have information about COVID, if you want to ride to the doctor's office, if you want to get tested, have a lab test done, or if you have mild symptoms or something. What you'll be asked. So if you call 911, they're going to ask you the location of the emergency, including your street address. So if you feel like you're the kind of person, and I can do this, if I get really anxious and overwhelmed, I won't remember, the number. Maybe I'll switch up the numbers. So have that, somewhere taped on your phone, or where you can see it, by your bedside or something, so that you have your address and you know exactly where to tell them to come. The phone number you're calling from, the nature of the emergency. And we talked about giving specifics, not just saying, well, I think I'm just feeling a little queasy, that kind of thing. Give specifics about why you're concerned. Maybe you have a heart history, anything like that. I've never had this symptom before. I feel this is making me feel like something, impending doom is one of, we didn't talk about that, but that feeling, we all know it, when you feel like something bad is happening here, that kind of underlying feeling. And so giving details. Who's going to come when you call 911? Used to be, you guys, I'm sure I'll remember this, if we had to call the fire department, we had to have a specific number for the fire department. We all had it on a refrigerator or somewhere next to the phone. If we wanted to call the police, we needed a specific number for the police department in our town. And if we wanted to call an ambulance, there was a specific number for an ambulance. So we had all these different numbers that we called. But then in 911 was officially established as a universal U.S. emergency number by this Public Safety Act in 1999. And ever since then, all we have to do, no matter where we are in the United States, is call 911. And when we call 911, you'll get somebody who kind of triages the call and decides what kind of emergency is. So if it's a police only call, they'll call the police and send the police. If you call about a medical issue, nowadays you typically get the fire department and an EMT. Many of the fire departments, including my son who lives in Monterey, they're all EMT trained, and most of the time they have a paramedic that comes with them too. So sometimes you'll just get the fire department, and the fire department usually typically arrives quicker than the EMT group. So who is dispatched to you depends on the emergency. Police officers are dispatched for situations requiring law enforcement intervention, such as a disturbance or a crime. Firefighters are sent for fires or other rescue-related emergencies, and they do come to all. They would come if you called for a cardiac emergency. Paramedics and EMTs, which are now part of the fire department, are dispatched for medical emergencies, providing immediate medical care and transport if necessary. So when you call 911, you will reach a 911 dispatcher at public safety access point. The dispatcher determines if your emergency requires police, fire, medical, and they'll transfer your call to the appropriate dispatch center. And you'll be asked your name, location of the emergency, phone number you're calling from. What can you do to help? Call 911. This is the most crucial step. Emergency responders can provide immediate medical attention, which is essential for minimizing that heart damage that we talked about. Sit or lie down, avoid doing strenuous activity, try to remain calm as you can. Take nitroglycerin if prescribed. Chew on an aspirin if available. If you have access to aspirin, chew and swallow one 325 milligram tablet. Aspirin can help reduce blood clotting. Wait for an emergency medical service. Do not drive yourself to the hospital. Emergency responders are trained to handle heart attacks and will give you immediate care. Also, opening the front door if you're able to so that they can get in, turning on lights so that they can see. Unlock the front door, turn on the porch light, stay on the phone until directed to hang up. If you're able to, locate your medication list because they may want to know what medicines you're on. If a family member who is falling to the hospital, remember to take your cell phone and charger. And the other thing is to set up your medical ID on your phone. How many here know how to do that? Raise your hand if you know how to. So what that is like right now, my phone is locked, right? Locked. If somebody were to pick this up, they couldn't get to my contacts or anything like that. And so what you do is then they just squeeze these two, oops, squeeze the wrong one. There we go. So they squeeze the two buttons there, and then it opens it up and unlocks the phone, not for all your contacts, but for your medical ID. So, and then what they do is they just slide this medical ID here. Whoops. They slide that, and then it tells all about me. It tells how old, and whatever you've put in here, it will tell them. It says, that I'm 70 years old. I'm an organ donor, for organs, tells the medications I'm on. It has my emergency contacts with all their phone numbers. So I have my kids in here. I have my adult emergency contact, and it has any conditions that I have are written there.
Allergies.
And allergies. So if you're unconscious or you're just so out of it, or you're so anxious that you can't remember anything, which you may be, they can just open this and get all the information that they need right there. So after class, we can help you if you don't have this set up on your phone. I know how to do it on an iPhone.
When you say squeeze it, press the two.
Yeah,
You have to hold it for a little while.
you do. You have to hold it.
When I did it, I got a screenshot.
Right. You have to hold it for a little bit, right?
Question.
Yes.
What's
$3.25, it's a regular aspirin, yeah. Mhm.
You take a regular aspirin if a person's having a stroke as well?
I don't think it's recommended for a stroke because it could be a hemorrhagic stroke. They don't know yet. Yeah. So setting up your medical ID on your phone, we talked about all this already, adding your emergency contact, your medications, health history, allergies, organ donor status. And then it can be opened by the EMTs or the fire department when they get there. Does it cost money to call 911? This is a big issue, isn't it? Fire departments do not charge for first responder services. So just to have somebody come out, which is going to be the fire department always arrives first, they're going to assess you. So there's no charge for that. You are generally not charged by a municipal fire department or EMT for their response because these services are typically funded by our taxes. Thank goodness, our taxes are going for something good. However, you will be charged if the EMT has to transport you to the hospital. What's the cost? $350? So what's the cost? No payment is needed at your time of service. That's good. You don't have to write a check right there. The average cost of an ambulance ride is $500. So you got a deal, Dodie. $500 to $3,500 without insurance. But if you have insurance, it's different. An ambulance ride with insurance cost is $250 to $1,500, depending on your insurance plan and your coverage. So it varies for all of us depending on our insurance coverage. I think I've got something in here about Medicare. The total cost of a ride in an ambulance depends on the location, distance traveled, level of medical support that they provided. So Medicare Part B will cover ambulance services when it's deemed medically necessary. And so if the fire department comes and they deem that it's medically necessary because they feel like your symptoms are heart related or emergency related, that's deemed medically necessary, and Medicare Part B will pay for your transportation. So if you're having a heart attack, if you're unresponsive, if you're bleeding heavily, that's deemed medically necessary. You may be eligible for covered non-emergency, which is what Dodie had. She was worried about the people coming here with the sirens and a whole, commotion going on. So we called for a non-emergency ambulance. I mean, she needed to go to the ER, but they didn't need to put sirens on and rush in here and do all that. And insurances will pay for that if they feel like you need required monitoring, which Dodie did require monitoring on the way to the hospital. She couldn't have just driven her car to the hospital. So it all depends on if it's considered, medically necessary.
An interesting thing happened for me when you called 911 and they came over. Apparently at this location, the fire department, if they don't have an ambulance that can come with them, they have a system of, they have alternate ambulance services that would come in and pay. So I had to pay for the EMTs because the fire department did not transport me to the hospital, but this other service did.
Yeah, usually the fire department will not, even if they have a paramedic, which a lot of them do, that arrives with their fire truck, they don't transport you to the hospital. There's an EMT associated with them that transports you if they deem that you need to be transported.
And if they're not available, they have a list that they go through and they call alternate ambulance.
I see.
The ambulance was paid for, but because they only provided the EMT service and not the follow-up ambulance trip, they charged me for the EMT service,
Oh. And how much was that, can I ask?
$350.
Yeah. So Tom got charged for the EMT service, $350.
Because the fire department did not provide.
Right, yeah.
But
But 350 is not bad.
And I charged anyway, and it was just the fire department that did.
But they didn't take you in the fire truck. But they had it, what they have is like an EMT almost. It's still kind of EMT. There's EMTs that are within that truck that they're transporting. Yeah. And every jurisdiction is different too, depending on how the county's set up. Yeah.
hospital, but it doesn't have like cardiac. I mean, I'm sure they can do stabilization. So like, would I get if I called an ambulance with a heart related issue, would I get taken to Sacramento or would they take me to Folsom or?
I think it depends on, yeah, you get taken where they think you need to be taken. So if they're feeling like you're gonna need a stent put in or something like that, there's no reason to take you to a hospital that doesn't provide those services. So they'll take you to whatever hospital they feel is gonna be able to give you the services that you need. The closest hospital that can give you the correct services.
You don't get a choice like. My doctor at UC Davis or.
If they feel it's an emergency, they'll take you to the closest one because they don't want to go to UC Davis if it's another 15 minutes.
Okay.
Because time is muscle, right? Yeah, that's why. It's not that they have some like contract and if it's something where it can wait, you can ask to go to UC Davis and they will do it many times. But if it's a cardiac thing, they're going to take you to the closest hospital that can get you the service the fastest.
Sometimes that is the one who, if
Well-
something else is needed, they can transfer you.
Yeah.
Okay. I'm just, yeah.
Does that make sense?
Well, it does. I did all the wrong things. Well, I didn't have a heart attack. I had, after I had the ablation, it was like 30 hours after I
Uh-huh.
got home. I started having shortness of breath, like it came on quickly and it
Yeah.
scared me.
Yeah.
And I had my grandson take me to the front, but we probably live less than a mile from the Folsom Hospital. I
Uh-huh.
went to their ER and I did get very quick care, there, but I ended up having to get transferred the next morning to Sacramento.
Yeah. And yeah, that's kind of typically what they'll do. Yeah.
Well, I know that now, and now I know I would call 911.
Yeah.
But I didn't.
Yeah.
Sherry's already given me a lecture. I gotta know.
And hear this information after the first event.
Yeah.
You really want to be prepared for
Right.
going forward for.
I think we all need to hear this, including myself.
Yeah.
You know, it's something, you know, we just put it out of our mind and I think, you know, our brains are wired to feel hopeful about things. And so for having a bad thing happen, we can easily go over to that, oh, you know, this is not going to be cardiac. I just, you know, did a hike 2 days ago and felt fine. You know, we go into that whole hopeful rationalization. So I think it's important for all of us to hear this information.
By the way, a friend of mine helicopter ride to the emergency room.
Oh.
Yeah.
That was $30,000.
Oh. Helicopter rides are $30,000 for those of you. Yes.
When you said, when the fire department is coming, so that EMT that's with them sometimes is not necessarily the fire department, they could be.
All the firefighters are EMT trained, but they will also, many of them have a paramedic that comes with them too.
Okay, but when they take you away, they have to, there's an.
They have to be transported in an ambulance. Yeah.
Okay.
Either an ambulance that's part of the fire department or an outside
So the
ambulance.
ambulance is, when a truck is coming, the ambulance is coming on now, absolutely.
Or soon after. Firefighters always get there first.
And
Huh?
You can also get access to the door.
Yes, if they get to your, good point, if they get to your house and they can't get in because you're unconscious or becoming unconscious, firefighters will, you know, go through a window and get in, yeah.
Well, real quick, my new neighbors moved in, like they hadn't been there that long and I didn't really know them. So woman rang my doorbell, it was like wee hours in the morning. And I remember she already had called 911, but I guess she was, I guess she didn't know that I was being better, but I didn't get hysterical because she was. But anyway, I was on the phone with the 911 and they told me what to do, because I think it was that bad, it was having something. But I kept saying, well, I don't hear they said they're on their way, but I never heard a siren. So at night, do they not necessarily run the siren? I mean, they're on their way, but.
You know, I asked my son about this because I had that very question. Do they always? Because I know one of the reasons that we don't call 911 is that we don't want sirens coming down our street and all the neighbors out in their pajamas watching, right? I mean, it's just silly, but we worry about that kind of stuff. You know, we think, oh, it's probably not a heart thing. And why am I causing all this commotion? So I asked him, he said that they always in Monterey, they always, if they think it's a cardiac thing, or if the symptoms are such, they always come with sirens, because otherwise they can't get there quickly. Cars are not pulling over, they don't see them. So they all said they always use sirens.
I just thought maybe because it was the wee hours, maybe there's not that much.
I don't think so. I think they always use sirens.
Cause when I tried my next day neighbors would tell me not that particular incident, but they sell these things. You know, the ambulance or whatever.
It could be if people call for something they consider to be a non-emergency, then they will not use sirens.
Just curious,
Yes.
sorry.
I lived in a gated, retirement community
Uh-huh,
and they did not use sign.
huh,
They were fairly close.
Yeah.
But that wasn't the reason.
Hmm.
There were so many people in there, almost 1,000 in 3
Yeah.
gated areas. It would be blasting all the time.
I'll have to ask him because
Yeah.
he works,
I'm sure
he
that-
goes into
I'm sure that-
Carmel where they're very picky about sirens in Carmel, you know?
They did not.
Yeah,
Anytime.
huh, I asked him about that. He said they use sirens, but I'll ask him
Ask
again.
About retirement.
Yeah.
communities.
Yeah, okay. Jody?
Have a really good friend that was an EMT for 5 years. And then she went through nurses training and she's now an RN in the emergency room at UC Davis. She and her boyfriend were at a concert that he was playing in a jazz band. And one of the musicians passed out. And she rushed up to him, did compressions on him, for I don't know how long, but a long time to revive him before. He was revived before the ambulance. got
Yeah.
there, But he would have died.
Yeah, so we're gonna talk about that. Good segue into use of the AED. Thank you, Dodie. So emergency, so there's AEDs, automated external defibrillators everywhere nowadays. We have one here. And do you know where it's located here? So see the microwave, like the big microwave sitting down on the right, there's that white, like a white plastic thing. It's got a bunch of stuff on it. Everybody see that? Like
Against the wall.
could you run over there and point to it?
Yeah.
Okay, Leanne's gonna cleverly demonstrate where the AED is located.
Come on, Vanna. I understand that they charge extra if you do hit the ambulance, the siren. Oh.
Yes, that's true. So everybody look, that's where it is. If ever anybody says to you, go get the AED, you can actually just bring the whole cart. Don't worry about just bringing the AED, bring the whole cart. But hopefully we will be doing that. But if for some reason that's where the AED is, it's good for you guys to know. And they have them at gyms, right? Every gym has an AED, every restaurant has an AED. They're everywhere now. So it's good to know how to use it because anybody can use an AED, right? So you could save somebody's life with that. And we're going to practice a little bit today. So this is Carrie's slide. Air goes in and out, blood goes round and round. Interrupt either and bad things happen. So yeah, so the circulation of the heart, basically this is the blood goes in through the atria, goes to the ventricles, goes out to the body. If you got a blockage someplace on your heart, it's going to interrupt this whole circuitry. And blood is just not moving through. The heart is not pumping because it's not getting blood. The heart has to get blood in order to pump regularly. If it's not getting blood, it's not going to pump normally. And you can end up with this. It's called ventricular tachycardia, which is the top one, or ventricular fibrillation, where the heart's just fibrillating. Either way, this top one, the heart's going so fast that there's no blood output from the heart. This is what typically happens during a heart attack. Ventricular fibrillation, the heart's just fibrillating and there's no output. So either way, no blood going out. And something has to be done pretty quickly. Can't even wait to get to the hospital. So that's why an AED comes into practice. Oh, this is an analogy. This is a Carrie slide too. The sign is known as like a teacher in control of her classroom. So normally the teacher, this little essay note at the top there, is in charge, sending out messages. She keeps everything under control. But when you're having a heart attack, what happens is you see those odd little beats there, those tall ones. It's like a couple children in the class start acting out and throwing spitballs and moving their chairs around. And the teacher's still gonna got control and the heart's still having a good cardiac output. But those two little aberrant children can get everybody else all riled up, right? Pretty quickly. And so then this is what you end up. There's the SA node is no longer in charge, and you've got everybody just firing, the class is out of control. That's kind of what happens with your heart. The whole heart's just firing and out of control. So an automated external defibrillator can shock the heart and get back to its normal rhythm. So when you got this erratic thing going, the thing that can work the best, CPR helps, but sometimes you need a shock to stop that electrical chaos. And when you shock, the heart has a pause, and there's a chance for the normal circuitry to take over, especially if you've been doing CPR and giving the heart muscle blood. CPR is giving blood to the heart where it wasn't getting any blood. That's what caused that chaotic rhythm. So you're doing two things. You're doing CPR and you're using the AED. Shopping malls, universities, gyms, senior centers, airports, arenas, hotels. And they're usually located on a wall somewhere. So it's done now. Yes. Leanne cleverly demonstrated, you missed it. It's right over there on that white cart. It's the red AED. Do you see it? But usually they're up on a wall and you'll see a sign for them. How many of you guys have seen these out and about? Yeah, they're kind of everywhere now.
Well, that's the thing that's miserably painful, we can have it without anesthetic. Shocking the heart.
Oh, well, if you're going to use an AN, yeah, you wouldn't use this unless somebody's unconscious. Yeah. And then they're not going to feel it.
I was in the ambulance, and we didn't have that. I had it.
Well, yeah, if you're under medical care, usually what they'll do is put an IV and inject really quickly, give you like a short acting thing that'll put you out just like for 2 minutes or 1 minute, and then give you the shock. But if they really feel like you're on your way out, they might shock you without doing that.
Sure.
Painful, yeah,
Moment, just for a moment.
yeah, just for a moment, but you lived.
No, I know, I just wondered if that's the thing.
Yeah, same thing, except they're using, shocking pads. This is the same thing though, works the same. So why don't bystanders go and get an AED and or start CPR? Why don't we do that? Bystander effect is one of the main reasons. We assume that others will help or that other people are more competent to help. So I had this happen to myself. I've had it happen not with an AED, but I've been on a plane and they said, are there any, medical doctors or nurses here that can help? And I always, before I put my hand up, I always look around, I think, oh, there's got to be a doctor here that's going to be more competent than I am. But that's maybe not true because I've been a cardiac nurse for years. So it could be that there's, like a dermatologist or something there. So, but I always do that. I always think, oh, there's somebody more competent than I am to help. So I wait. And then if I don't see any hands, then I put my hand up. And twice on an entire plane, I've been the only person that was there to help, So I think, and I bet you there probably was somebody else on the plane that kind of knew what they were doing. But anyway, so we all do that. So, going and getting an AED and bringing it over and telling somebody to call 911, that's huge. Just doing that. And you'll see how easy this AED is to use. So don't assume that others will help. Jump in there and say, well, I'm just going to do the best that I can. Also, if there's an emergency going on, we can get this fight, flight, and freeze response to an emergency. Some of us, if it's an emergency, will just freeze, and we just can't think straight and we don't even remember where the AED is or can't figure out how to get it out of the wall. So that can be a reason sometimes that we don't help. We also can misinterpret the situation, think that somebody, just fell, especially if it's a young kid that they fell and they're fine. We don't really go and look closely to see if they're unconscious and they really need help. Fear of causing an injury. And the truth is, looking at the studies that they've done, doing something is usually better than doing nothing when it comes to cardiac issues. Also, we have a fear of catching disease, from doing, mouth to mouth or doing compressions, especially with COVID. So they actually have changed the recommendations now for the public. They recommend compressions, not mouth to mouth, and an AED. So, I mean, you could do mouth to mouth, but what's the protocol basically for all of us in the public, if you're not a trained medical person, is to do compressions and use the AED. And there's also fear of legal ramifications, but there is the Good Samaritan law. And the Good Samaritan law provides legal protection or immunity from civil life, from being sued, to individuals who voluntarily and in good faith provide reasonable assistance to a person in an emergency, even if that assistance results in unintentional harm. So we're protected there.
My sister lost position and she saw an accident. So she went, stopped and went to help. And the mom was in the back of this camper making pancakes. So the camper went over and the lights went out. She was examining it by touch because the lights are out
Yeah,
and she thinks there's blood.
yeah.
What happened is she was making pancakes and the syrup got
Oh,
everybody in the camper.
oh, yeah.
So it all felt like
Blood.
blood. For her, till she hauled them out into the light and discovered it's pancake syrup.
I won't tell you that whole story for home, but basically pancake syrup feels like blood when it's dark. Okay, yes.
The pulmonologist friend who had an emergency on the plane and they went to give the patient oxygen. They didn't think the oxygen bag was working because it doesn't compress or anything. So he had to rethink it. you know,
Yeah, yeah,
But
yeah.
anyway, that was one of the issues they ran into.
Yeah. Well, there's always going to be little issues, but hopefully today you guys get a little bit more comfortable with using the AED. So just as a brief thing here, women get a bum deal when it comes to having the AED used on them. In a public place, only 32 to 45%, depending on the study, of people receive CPR and or get an AED for a cardiac arrest. That's a low number, isn't it, in a public place? Yeah. Women were 14% less likely to get CPR and or bystander care for an out of a hospital cardiac arrest. 40%. Well, survival rates for out of hospital cardiac arrest were 23% higher in men than in women. Why? Bystander discomfort with the female anatomy. They don't want to run up and pull up their shirt and start, doing chest compressions, especially with all the liability recently, right? Concern for sexual assault accusations. Also, this is a big one, misconception that women don't have as many heart attacks. So thinking, oh, it's a woman. I think this is less, that kind of thinking is less, but 20 years ago, this was common. Oh, men are the ones that have heart attacks. And so women were less likely treated even by physicians when they came in with symptoms of having a heart attack. Misconception that women are fragile. So is it safe to really start pounding on their chest or put an AED on? We're just a little bit more scared about it. Bones get broken when we do CPR, in men and women. Okay, so now we're going to have an opportunity to use this AED. Where can everybody see? Maybe I'll just focus over here. I don't think they're going to be able to see it.
I know, I couldn't get my camera.
Should I? It won't work. Should I?
I'm gonna turn this.
Would it work if I went back here? Leanne? Would it work if I went back here
Yeah, try that.
for them to see me?
The home screen is getting.
Oh, that's good.
Yeah.
Can you see me at home?
Yeah.
Oh, she put a little heart. Good. Okay. All right. So we already have an emergency because this particular person has two right arms. So, but I'm not competent to deal with that. So we're going to leave that until they get to the hospital. Okay. So, say that, you guys were at a gym and somebody said, well, you wouldn't be at a gym because you're here, but some of you go to the gym too. Say you're at a restaurant and somebody says, go get the AED. So they're gonna, all look different. There's usually a label that says AED. Ours here is that red one over there. If we ask you to get the AED, just bring the whole cart to us. But usually it comes in something that has to be unzipped. So the first thing you'll do is unzip it. I've already unzipped this. Open it up, and you don't even need to take it out of the package. And then what you have to do is there's a power button. Usually it's labeled power. This is an old one, so it's not labeled, but it's the green button. And even if you pressed one of these other buttons before you press the power button, it wouldn't matter because it's not on yet. So don't worry if you're going to press the wrong button to turn it on, because it doesn't matter, because this is the shock button, but it's not going to work because it's not turned on yet. So just press a button and get the thing turned on. Okay. So I'm going to press this green button. And then,
Begin by removing all clothing from the patient's chest.
so it gives you,
Clothing if needed.
so did you hear what it said? What did it say?
Young lady.
Cut it off. if it-
Begin by
If the
removing,
patient's chest is bare, remove protective cover and take out white adhesive pads.
so it's giving you instructions. It's told you to make the chest clear. So this guy's already, if not, you just put a shirt up, or you could, cut
If
it.
the patient's chest is bare, remove protective cover and take out white adhesive pads.
So we're just taking they're all going to be different, but you won't have any problem with that. It's clear how to just open up that thing always. And then here's the
When
pads.
patient's chest is bare, remove protective cover and take out white adhesive pads.
Okay, so
Place pad exactly as shown in the picture.
There's a picture.
Press firmly to patient's bare skin.
so I'm going to put one up here. The only reason that this,
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firm. No one should touch the patient.
so once they think you've got it on there, they're going to say, don't touch the patient. So everybody moves back. You don't even touch the hand.
No one should touch the patient. Shock advised.
So they're saying a
Stay
shock at the
clear
eye.
of patient.
So
Press
everybody
the
clears, so
button
nobody
orange
touch.
button Now.
So now I'm going to press the
Press
shock
pad
button.
firmly to patient's bare skin.
It's not really going to shock because this is a training model, but you would see the patient move.
Make
It's still
sure
shock.
that the yellow plastic liner is completely removed from both pads. Place pad exactly as shown. No one should touch the patient. Analyzing.
So it's analyzing to see if it's VFib or VTAC.
No one should touch the patient. Shock advised. Say shock delivered.
So shock delivered.
Be sure
And then you start
emergency
CPR
medical
right after
services
that.
have been called. It is safe to touch the patient. Begin
Safe to touch the
CPR.
patient, so you
To
start
help with
CPR.
CPR, press the flashing blue button.
We're gonna turn that off then. Okay, so all I want you guys to do is, we're not gonna do CPR today and all that. I just want you to practice getting the AED on and turning on the AED.
Do the CPR with the pads on still?
Yes,
Don't-
you don't take the pads off. Good question. You start CPR until somebody brings the AED. So you're here doing CPR, and you're saying you called Dodie, call 911, Judy, you bring the AED, you're doing CPR. And then when the AED arrives, you get the pads on, and then it analyzes, it tells you what to do. If it says shock the patient, you shock them. And then usually they'll say resume CPR, and you resume CPR again. And then usually it's a 2-minute cycle. So you do CPR for 2 minutes, and it knows. And so then it'll say, analyzing, and you'll stop and it'll analyze, and it might have you give another shock. So it's kind of in charge. It tells you what to do.
Is that just CPR with the pumping, or do you do the breathing? as
If we
well?
were here, we'd be doing the breathing too. They're saying if you're out in public, that you can just do the AED and the compressions. Yeah. If you're out in public and you've got some sort of there's a lot of little breathing things that you can put over people's mouths and do CPR. I have one in my car.
Think that they would have one in that,
Mm.
that kit.
Yeah. I think it's because now people are so wary of doing mouth to mouth that they just recommend in public to do. I mean, it is better to do compressions and mouth to mouth, but the compressions are the most important part, really. That's what gets blood to the heart. That's why you're having that ventricular fibrillation tachycardia, because there's no blood getting to the heart. So this is really the most important thing, and the AED. So they're letting it slide on the mouth to mouth.
Going back to the bare chest, if the person is really hairy, you do have to deal with that. And sometimes there's a razor in these kits.
Yeah.
You can actually
Get the hair off, because
get the hair off.
if the pads don't stick, it's gonna say, it's gonna keep telling you, put the pads on. Because it perceives whether or not they're in well enough to give on well enough to give a shock.
How do you know when you can stop doing anything?
Yeah. If usually you've called 911 and they come and they take over. I've never had to stop on my own. If you were just all by yourself, there's 911 people are going to come and they're going to decide. It's usually a physician that stops a code. So I've always just kept going until you can't keep going. If there's no physician around, you're going to get tired, and there's going to be a point where you can't go on. So
When we had our CPR classes last month, there was a horrible story that the trainer shared where some friend of his was camping with his father out in the remote area, and the father had a heart attack, and this poor younger person basically did CPR in it for like 2 hours. And he was just too exhausted and quit,
Yeah.
because he was wiped out, but pretty tragic scenario.
Yeah.
But so you do it till you can't do it anymore,
Yeah.
or until somebody else can take
Yeah.
over for you.
right.
Because all the CPR is doing is getting some blood back in the heart. It's not-
Yeah, that's why the heart stopped, is because it wasn't getting blood because of those blockages. And so it went into a really fast rhythm called ventricular tachycardia, or that fibrillation. And so you're helping get blood to the heart. And then the AED is shocking you out of that electrical rhythm that's not efficient.
And none of that may work, and so you keep doing it.
Keep doing it. That's right. And when the 911 gets here, they can give medicines that can work with the CPR and the AED, the shocking, to help stimulate the heart. So once they arrive, they get more medicines. They'll start an IV, and they can do medicines and stuff on the way to the hospital.
What does the nitroglycerin, whatever he was talking about, this would have anything to do with this?
Well, if they're unconscious,
Oh, he's not conscious.
Yeah.
Repeat the question.
Hmm?
Repeat the question.
what would you use nitroglycerin in this case? No, yeah.
The breath important to protect from brain damage, because oxygen is against the brain.
It's important for the heart. The heart needs oxygen too,
Yeah.
but the studies show that the compressions are the most important part.
And you only do that if they're unconscious.
Yes,
If they're awake.
Yeah.
Do not.
you do not.
He's not sure.
Okay, I want you guys to try now. So come up and come around this. I'll move it over here where you guys can have more room.
Should I end the?
Yeah, I guess end it because they can't, yeah.
Okay.
So use it home. Thanks for coming. Any questions?
No, this has been really good. It really addresses the issue of being hesitant to do things.
Yes, and we all have that. It's
Yeah.
common.
All right.
Okay, I'm gonna stick this back in
Thank you,
here.
everybody.
It's good.
Yeah, it's just, I think